I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor, practice in the United States, Kentucky. So during my clinical visit, I'm seeing this Hispanic woman who's here for health maintenance visit. So basically, these are all yearly visits that are geared towards focusing on preventative screening, labs and things like that. But it's also a great opportunity for the patient to check in with the doctor to see if they are doing everything they can to make sure that they have a pretty good long-term health, or they need to change their lifestyle in order to align with their health goals. Her age is 45 and she has a basal metabolic index of 28, which is considered overweight, though BMI isn't always a comprehensive measure of health. Additionally, she has an enlarged waist circumference of around 36 inches, predominantly around her abdomen. She currently didn't have any symptoms at all. And by the end of the visit, I was talking about getting some labs for her, especially screening for diabetes and cholesterol. And at that time, there was some resistance. Essentially, what she's asking me is that if she does not have any symptoms, then why she should be tested. So believe it or not, in the clinical world, I've been accused multiple times that patients tell me that diabetes was invented for the pharmaceuticals to make more money. Sometimes influencers say that, the threshold for diabetes was only 140 milligram per deciliter around 1990s, and now it's 126 milligram per deciliter. So this is just kind of like a change that has been made so that the pharmaceuticals can make more money because we make more diagnosis of diabetes. Obviously, this patient did not accuse me of anything like that, but she's asking an important question. Again, she's spending money to do those labs, and what she's saying is that she does not have any symptoms. Then what is the purpose of spending the money on these screening labs? It is important to understand that there are two main types of diabetes, type 1 and type 2. Although there are other varieties like maturity onset diabetes of young, latent autoimmune diabetes of adults, we'll keep it simple as just two types for the purpose of this video. In type 1 diabetes, there is an autoimmune attack. Basically means that the body's immune cell attacks a particular cells in the pancreas that produces insulin. And this attack happens suddenly. So what this means is that, the person might be having a normal blood sugar, and suddenly the autoimmune attack happens, thereby creating the insulin deficiency. When there is no circulating insulin in one's bloodstream, the blood sugar starts to rise. When the blood sugar starts to rise, you start to develop symptoms of increased blood sugar, which is basically increased urination, increased thirst, increased hunger. And sometimes some people might develop a deadly complication called as diabetic ketoacidosis because there is no insulin. The body starts using ketone bodies for energy, and when there is excessive ketone bodies, this can lead to ketoacidosis, which can be life-threatening. Fortunately, when the patient just starts to develop these symptoms of high blood sugar, of increased urination or increased thirst and increased hunger, when they come and see me right away, we can make a diagnosis right away and then start them on insulin, and this way we can prevent those life-threatening complications like diabetic ketoacidosis. So now we have type 2 diabetes. The key thing here is that there is no autoimmune attack against the pancreas that causes the insulin production to stop abruptly. An unhealthy lifestyle, which includes a poor diet primarily consisting of high quantities of processed foods, sugary snacks and beverages, as well as excessive amounts of saturated and trans fat, can lead to this condition. Other contributing factors include a sedentary lifestyle, increased alcohol use, and sometimes even chronic stress. So these factors cause a condition known as insulin resistance. So basically, the insulin is not able to do its job properly. In order to overcome the insulin resistance, the pancreas has to produce more insulin. But remember, the effectiveness of the pancreas is driven by the genetics that we're made up with. For example, some patients, they'll develop diabetes within like 2 to 3 years of starting an unhealthy lifestyle. Some patients can continue with an unhealthy lifestyle for years together before they start developing diabetes. Again, this is dependent on each individual and is very hard to predict. But the key difference between type 1 diabetes and type 2 diabetes is that in type 1 diabetes, the insulin deficiency starts abruptly and thereby the blood sugar goes up. Whereas in type 2 diabetes, it is a slow process. So what that means is that, let's say for example, in around like 2015, the patient could have started developing a slight prediabetes, which means that the average blood sugar is slightly higher than normal. And then as years go by, they slowly have their average blood sugar go up. So basically the average blood sugar might be around like 130s, and then it might be 150s, and then it might be 170s, and then it might be like 190s. As you can see, since there is a slow increase in average blood sugar, they may not start developing the symptoms of hyperglycemia like the type 1 diabetes does. From a symptom standpoint, not everyone develop diabetes symptoms right away. For example, I've seen patients with varying number of A1Cs, like from A1C of 7 all the way up to 11, without any symptoms at all. A 1998 study observed the same phenomenon, examining 430 subjects and finding no strong correlation between A1C levels and patient symptoms. This suggests that one can live with high blood sugar for years before possibly developing symptoms. This is not good, and here is why. In a study known as the ADVANCE trial, researchers focused on diabetes, and they discovered that keeping A1C levels below 7% is important to reduce the risk of major cardiovascular complications like heart attack, strokes, and peripheral vascular disease. Keeping A1C below 6.5% is crucial to decrease the risk of microvascular complications such as retinopathy and diabetic neuropathy. So this is why when I diagnose a patient with type 1 diabetes, I'm not worried about long-term complications because I know that this happened in the last few weeks or so. But the type 2 diabetes, it's very hard. For example, if I see a patient with the A1C of like 10% or so, now the question is that how long has this patient has had elevated blood sugars? And depending on how long this patient has had elevated blood sugars, the complications have already started happening in the body, which is why it's important to make sure that we start to look for complications like, check their feet regularly and then check their eyes to see if they have had any eye complications or so, and then start to decrease the risk of heart complications by addressing their cholesterol, starting to exercise regularly, and so forth. Shifting our perspective is crucial. It's not accurate to think that doctors diagnose diabetes solely to prescribe medications. Early diagnosis can pave the way for lifestyle modifications. So for example, the patient who saw me for a preventative health visit, I've already initiated a discussion about healthy lifestyle changes because she already has risk factors for diabetes. She has enlarged waist circumference and she also had a sedentary lifestyle. We already initiated the discussion about those lifestyle changes. I'm not waiting until the patient is going to develop diabetes. We are starting early so that this way we can prevent a person from having diabetes. But let us say if I conduct a blood test and then she is diagnosed with diabetes, and at this time, the only thing that's going to change is that how aggressive should I be? So for example, if their A1C is still under control, I would still just continue the lifestyle modification and not start any medication. But let us say if the A1C, which is the average blood sugar, if it's really high, in that case, I would probably start a medication along with lifestyle modification with the goal of trying to come off the medication as soon as possible once the lifestyle modification sets in. Sometimes patients will ask me, let's say if the A1C is really high, they still don't want to consider medication, they want to consider lifestyle modification alone. Implementing lifestyle modification is challenging. It's far from straightforward, especially given that the behaviors that led to these health problems are deeply ingrained and require considerable time to change. Moreover, it takes time for the benefits of these changes to become apparent. Therefore, during this transition, medication might be considered as a supportive measure to bridge the gap. Remember, in life, we often face with paths we must choose. Sometimes we end up on the wrong path, but the sooner we realize it, the easier it is to return. This principle applies to diabetes as well. The earlier the diagnosis, the easier it is to manage or even reverse, which is crucial. So when I tested this patient for diabetes, her A1C came at 8.4, which is a pretty uncontrolled diabetes at this stage. So then we started lifestyle modification, we started on medication, and after 6 months to a year, she was able to come off the medication completely and her A1C is 5.4. But she also mentioned that she's feeling more energetic as her A1C have dropped to 5.4. So this brings up an important point. She mentioned feeling more energetic, a symptom of improvement many may not recognize because they've adapted to feel a certain way, believing it to be normal. Once you improve your health, you can truly understand the difference. I would highly recommend to discuss with your doctor to see if you need testing for diabetes. In the last few years, I've seen a lot of people with a normal BMI still testing positive for diabetes, especially in Asian descent, Hispanic descent, and so forth. Again, if you have a strong family history of diabetes, then you're at risk as well. Remember, getting checked doesn't automatically mean that you need to start medication immediately. I recommend having a discussion with your doctor. I believe in creating a care plan through discussion with my patients, and I hope you find a doctor who values collaboration in managing your diabetes effectively. Remember, there is one habit that can help prevent diabetes, and as well as treat diabetes as well, and that is regular exercise. If you want to know more about how exercise helps with diabetes, then check out this video here. And if you really like this video, if you found this video helpful, please make sure that you hit the like button and please share this video with others so that others can be benefited as well. And I'll see you in my next video. Until then, goodbye.